हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के कार्डियोलॉजी सेक्शन के सब इंपॉर्टेंट MCQ। A 35-year-old male present to the clinic due to EG bruising, fatigue and bone pain. He has a history of frequent infections. On examination, he has hepatosplenomegaly. Laboratory test reveals a low platelet count and elevated levels of glucose riboside in the blood. This condition is a lysosomal storage disorder caused by the deficiency of glucose riboside. Which cardiomyopathy is associated with this disease? Here the question asks the lysosomal storage disorder with the deficiency is the glucose riboside deficiency. The glucose riboside deficiency is in a Gaucher disease. Gaucher disease is a lysosomal storage disorder caused by the deficiency of enzyme glucose riboside. Can lead to the accumulation of the glucose riboside in various tissue including the heart. And including the heart, this accumulation in the heart can cause infiltration and fibrosis of the cardiac muscles and other structures, leading to the development of restrictive cardiomyopathy. Is the answer. Next question. A 30-year-old male present to the clinic due to exertional fatigue and difficulty breathing for the past few weeks. His blood pressure is 150 mmHg. Heart rate is 80 beats per minute. Respiratory rate 60 beats per minute. SpO2 90. Examination reveals dichrotic pulse. Which of the following changes can be seen in the disease? Here the increase EDB, increase ESB, increase contractibility, decrease EDB, increase ESB, increase contractibility, or increase EDP and increase ESB, decrease contractibility. Here the answer. Because the dichrotic pulse with the exertional dyspnea indicates the dilated cardiomyopathy. Increase the in diastolic volume EDP and DCM is characterized by the enlargement and dilation of the left ventricles, which can lead to an increase in the volume of the blood filling the ventricle during diastole, resulting in a decreased EDP. Next question. A 34-year-old Fmge woman at 37 weeks gestation comes to the physician because of a 1 week history of progressive fatigue and shortness of breath. On examination, there is a bibasilar lung crackers, jugular venous distension, and 2+ pitting edema. Abdominal lower extremities. Urinary assay shows 1+ protein echocardiography shows left ventricular ejection fraction of 0.35. Which of the following statements is true regarding the most likely diagnosis? The most likely diagnosis is the peripartum cardiomyopathy occurs within the last month of the pregnancy or up to the 6 months after pregnancy. Because the peripartum cardiomyopathy is characteristic by the development of idiopathic heart failure with the reduced ejection fraction HFR EF months after or before birth. If it is diagnosed based on the left ventricular ejection fraction of less than 0.45 on echocardiography and is the absence of the potential cause of the heart failure. Most potential experiences partial or complete postpartum resolution of heart failure within the 6 months of delivery, but other requires continued managements with the heart failure medication devices and the or heart transplantation. Next question. A 50-year-old male present to the emergency department with diffuse chest pain at rest. He says the pain radiates to his left shoulder and is relieved when he sits up. A scratchy sound that persists when the patient holds his breath is heard on cardiac auscultation along with normalization and anesthesia. What is the most common etiology of this presentation? Idiopathic, viral, autoimmunity and malignancy. Here the answer is the idiopathic because the clinical feature of the diffuse chest pain at rest that are relieved on the sitting of radiation pain up to the left shoulder and the presence of the scratchy sound and the auscultation of pericardial friction are typically pericarditis. Pericarditis can be various causes and is the most cases. The exact common remain unknown. The idiopathic pericarditis is the most common cause. A 42-year-old female present to the ER with progressively worsening shortness of breath and chest discomfort for the past week. On examination, distant heart sound, elevated jugular venous pressure, with blood pressure 80 by 60 mmHg are noted. ECG shows low voltage QRS complex. What is the most likely diagnosis? The cardiac tamponade. Because the finding a big distant heart sound, elevated jugular venous pressure and hypotension indicate cardiac tamponade. The low voltage QRS complexes on ECG are seen in both tamponade and pericardial effusion. Blood pressure is the differentiating factor. Next question. You are an intern measuring the blood pressure in the ER. You notice inspiratory fall of systolic blood pressure more than 12 mmHg. Which of the following conditions will not show this finding? Pregnancy, constructive pericarditis, pericardial effusion, massive pulmonary effusion is the correct option is the pericardial effusion. Because the inspiratory fall of the more than 10 mmHg indicates the pulsus paradoxus. It is seen in the cardiac tamponade but not in the pericardial effusion. Here the question shows the more than 12 and the main criteria is the more than 10. So that's why the pericardial effusion. And tamponade causes the diastolic collapse of the ventricles, causing the severe hypotension and the fall of the systolic blood pressure. That's all. Thank you and keep revising.